sad situation because people won't freaking stay in middle like they're supposed to. Yeah, no diaphragm's a little wonky.
I have a good angle. I'll post it on YouTube and send everybody the link.
Like a big turkey. Okay, so we are just going to start with our lids and then walk all the way through. So, number one, your liver, of course, is this entire structure here. It's above the stomach. Quite large. Usually, if I'm pinning it, I'll put the pin in this lobe, kind of sitting right here in the middle, so it's very clear. Or I could put it over here. It's definitely focused on the liver. Gallbladder, much more squishy, right? So, always on the right side. And most of the cats I've seen, they look pretty good. So, occasionally I will cut like some of the liver off so that you can see it a little better, and then put the pin inside the gallbladder. So it shouldn't be confusing. Esophagus is behind your trachea, so the one with the little circular rings of cartilage is the trachea. And if you lift it up, and I'll cut y'all, see how there's a hole in it? But if you remove it, you can see that soft tube. You could follow it all the way down into your stomach if you wanted to trace it all the way through. On the cat, a lot of times I'll cut the trachea. I'll cut here and take a piece of the trachea out, exposing the esophagus behind it, pin in the esophagus. Or sometimes I'll just pull the esophagus out, kind of like that, get a pin there. Basically, no cartilage, soft squishy tube, pinned up here, the esophagus. Should be pretty clear. Stomach, I'll always put it right in the middle. So, this is okay. I usually find one a little better than that, but it's kind of shaped like a J, and it'll be sticking somewhere like right there. It won't be close to the duodenum, so it's not confusing. I'll put it somewhere like dead center, like in the body region. Rugae, leave those alone. That's the inside lining of the stomach, basically, little wrinkles. Caloric sphincter. If it's on there, you can see where the stomach's coming around, and there's that little division point where it's like the stomach stops and the intestines begin. So this dead center of the division point where this connective tissue is, that would be the caloric sphincter. You can actually feel it. It's a lot harder right there than it is right here. It's squishy, and that's real tough. So that's the muscle in there. Duodenum, I will pin very close to the stomach, but not somewhere in the middle where it's confusing, so it'd probably be about like right there, where the pin is clearly in the small intestine, but not in the stomach, but it's close. So duodenum's close. Jejunum, I'll just randomly stick a pin in the middle somewhere, that middle section. Ileum, you will want to see where you're at. You got your colon going out the door, or large intestine, you can say either one. Transverse and ascending's over here, so you can see where this section, small intestine, is going into the colon. You also note that you got the ileum, a valve there. The valve that lets the intestinal contents into the colon, or large intestine. And you also have the colon's little blind end, this little pouch called the cecum or cecum. So look at where you're at, and you shouldn't miss it. If there's a pin like right here, it's in the small intestine, it's real close to the cecum and to the large intestine. It's ileum. Duodenum close to the stomach, jejunum somewhere in the middle, ileum real close to where the cecum is.
How many pins are there going to be?
Per cat? 4, 5, 6 cats.
6 cats?
Yeah. So definitely can't get all of this. Large intestine colon we've seen. I normally pin it like right there. It's going out the door, that way you know that's where your kind of logical location to pin it. Omentum is the fat that covered all this. If I'm pinning that, there will be a pin sliding through it. Okay? So you slide through, and that's all your omentum. Pericardium, the sac. Y'all can still see some of y'all, right? Once again, I would have a pin sliding underneath it like that. If the pin is just stabbing straight in, then that's the heart. If it's sliding through the sac, then you've got pericardium. Same thing on mesentery. I'd have to unfold everything, find a good section, and have a pin sliding through the clear connective tissue. You see, holding your intestines together. Peritoneum's another slide through. It's the inside lining of the abs. They lift up right there. See the clear? So a pin sliding through that. See my scissors underneath it now? That would count as the peritoneum or peritoneum. Kidneys, of course, be sticking straight in. Left or right applies. Got another one over here. That's a good one. Be a good one to pin. Ureter. So find your bladder, always down, pelvic cavity. Where the tube, which you can see here, coming from the kidney, right, comes in and connects to the bladder, that is a ureter. Bladder, of course, is the sac itself, just be sticking straight in. Urethra, I would dissect all this out a little bit better. But you should see that tube right there. You're going out the door, that is the urethra. So your bladder has 1, 2, 3 openings. Trigon. Let's see, for male vas deferens, this will be pulled back, and you see this little loop right there. That loop crosses over the top of the ureter. There would be another one on this side. You can see right there. Got my scissors under it. Remember, the testes are abdominal organs that descend into the scrotum, so that's why they have that little weird pathway. That would be, I'd lift up and have a pin sticking in that. A little small there, but maybe. Testes, of course, can be dissected out. They're external, so there's no way to miss that one. Pretty easy. Ovaries, if this was a female, there'd be another set of tubes right here, kind of shaped like a U. Pretty good size, way bigger than a ureter. And right around here at the end of that tube would be a little ball, pretty small. That would be the ovary. So a pin in the tube would be the uterus on either side, since the cat has multiple babies. And then a pin in the little ball at the end would be the ovary, if it were a female. You got heart, spleen, right there. Location always on the left side, right? Diaphragm, sheet of muscle, separates the thoracic abdominal cavity. Pin will be sliding through it. So, breathing. Lungs, of course, you got right beside the heart, set there, and a set there, right and left, and then trachea we've already covered. Alright, so arteries, we do arteries first. Brachiocephalic, actually, let's do them with pictures. These are really older ones, so it'll help you kind of go along. So if you find some part, and you make sure they're always, they're pink, right? Your aorta comes off of the heart right here, flips and kind of runs down your backbone. You can see, if I can get everything shoved away. See it still going down? Clear it up. Big giant vessel there. So this will all be kind of pulled over to the side. Sometimes I'll remove the blue vessels if I'm trying to pin the arteries really good. Remember, the pink or red color is an artery. But the first branch off of the aorta is the brachiocephalic artery. First branch off. Right beside it, this branch here. Left subclavian artery, which will go out if you followed it. Up over here and out into the arm. Once it's in the arm, anything like that one there, anything pink or blue pinned in the arm, like where the humerus is, would be brachial. Brachial artery, pink, brachial brachial vein blue. Brachiocephalus in a branch tree at a time. That'll vary a little bit from cat to cat. This one, dissected out before I put it up yet. Let's see what I can do real fast. Chicken foot kind of thing. 1, 2, 3. Right there. 1, 2, 3. Right subclavian artery. If you follow it, it goes out this way and into the arm. Right carotid artery. Follow it up, you can still see it going right there. Left carotid artery, same thing, follow it up, you can see it going right there. See how that one's connected to this. So, pretty clear. Little chicken foot thing off the brachiocephalic. Brachiocephalic here. Right subclavian, right carotid, left carotid. And that's kind of all you can have up north. Now going back down the road. Find your diaphragm, find where it stops. Right there. And as soon as it stops, after the diaphragm but before the kidney, that's what the picture's trying to show you. You'll find pink vessel. Clear it up a bit. Can you see it now though?
Yeah.
Right there. First branch past the diaphragm, celiac artery. Right beside it. Second branch past the diaphragm, superior mesenteric. Both of them attached to the aorta, which you can still see right there, traveling down your backbone. Renals are easy. If it's big and blue and going in a kidney, it's a renal vein. If it's see this pink one back here, right there, pink one going into the kidney would be the renal artery. So, of course, renal artery actually is going into the kidney. Renal vein is coming out of the kidney. I'll reverse that for purposes, but the veins are going back towards the heart, right? Arteries going away. Inferior mesenteric, following the aorta down. After the kidney, but before you get to the iliacs, you'll find a pretty good sized vessel, which you can see there. Connect the tissue off. Clear it up some. Nerves and things out of the way. There you go. Just a little more pink. See? Attaching to the aorta, inferior mesenteric. Then you split. You have external and internal iliac arteries. Okay. That's a good one there. So external are on the outside. You have a right and left external iliac artery. Right here in the pelvic cavities where it splits. And then you have another little Y in the middle. Didn't inject quite as well on this cat, but that's your internal iliac arteries, just like your picture shows. Now, you haven't dissected it out yet, but if you were to clear out muscle tissue and stuff and get a little deeper in there, anything that's pink and dissected out by the femur in the leg is going to be the femoral, right? Anything that's blue is also going to be the femoral, so it's kind of like brachial. If it's pink and then the arm, brachial artery. If it's blue and then the arm, brachial vein. Same thing here. You can't really miss those even though they're not dissected out. Veins are simpler. You have common iliacs, which are underneath the externals. You'd actually have to remove this, but zoom in. See that blue hiding underneath there? That's there. There's a blue one there. There's a blue one on that side. You can see there. So it's femorals come in, and where they start to join in the pelvic cavity, right underneath there, it's called common iliac. When they come together, from that point on, that is the inferior vena cava. Going all the way up, underneath, through here, find your liver, diaphragm. You can see it there too. Look, coming out of the diaphragm, you see the big blue one still?
Yeah.
Right there. You can see where it's going, right into the back side of the heart, into your right atrium. So from here up, it's inferior vena cava. That can be seen anyway. renals, of course, for the kidneys. There's nothing else to worry about down there. A zygus, superior vena cava coming in the top. Flip over a little bit. You'll see another blue one. Didn't inject well, but you can kind of see it right there. See the blue? It actually runs further down, just didn't inject it. But it connects right into the superior vena cava on your right side, like the picture shows. So, in here, superior vena cava, in there, thing connecting into it, the side. Now, here's where you use imagination. I messed up. So, superior vena cava is gonna, it's all coming down, right? But I'm just gonna follow it up. It will eventually Y. You can see part of it here, or part of it would be right here. You can kind of see remnants, right? Right there, right there. So where it splits the first time are the brachiocephalic veins, right and left side. Now this brachiocephalic vein, and you can see it's not injected. See that? That is an uninjected vein. That one injected good. So from here to here would be the brachiocephalic vein on the right side. That branch going out through the arm would have been the subclavian vein. The one that's going more north would have been the jugular vein. In reality, everything's coming down. So jugular vein drains from the head right down. The subclavians drain out of the arm. All of them dump to brachiocephalic. Both brachiocephalics dump to the superior vena cava. It dumps into the right atrium. So basically, everything up north drains right back to that vessel. That goes to your heart. Just like all your veins down south all drain right back into the inferior vena cava. And y'all remember the story from there, right? Mm-hmm. Right atrium, tricuspid, right ventricle, coronary valve, right? Same thing on the left side, it mirror images. You're just flipping it. So if I got a cat that was really good, watch where it's pinned. Close to the heart, superior vena cava. The first branching, as soon as that superior kind of takes a Y pattern, brachiocephalics. When you follow that one and it Y's the second time, that's when you get into one going out, subclavian, one goes down north. And that's the jugular. Technically easier. I think hepatics on your list, you don't have to note yet. If I'm remembering right. Intercostals are on your list. These are vessels in between the ribs. I can't pin those. They're too small, but you can clear out and see them. There's red ones and blue ones. Some big cats you can get a can. Hepatics of liver, the portal system. And if you dig down, you'll see that vessel coming out of the big blue thing coming out of the liver. Right there. It's really just part of the inferior vena cava. But if you dig through, the liver has a good blood supply. You have all that big blood vessels coming out top. That'd be hepatic. But no stress there either. Internal jugulars, typically too small, sometimes absent, didn't inject well. So, you got all the names down we just covered, you are good to go.